Most, if not all, of retinal surgery is done as an outpatient, which means you'll show up, you'll have the surgery, and then we send you home the same day so you can sleep in your own bed. In general, if your surgery is in the morning, we ask you not to eat anything after midnight. In the morning, you can take your normal medicines with a small sip of water. It's especially important to take your blood pressure medicine. If you're diabetic, then we'll give you special instructions about your insulin and your diabetes medicines to make sure that we take care of that as well. It's better not to take aspirin within 14 days of your surgery. If you do have a headache or something like that, Tylenol works just as fine and doesn't have the blood thinning effects. If you are on blood thinners, we'll be working with your cardiologist or your internist to see the best way of managing those blood thinners before the surgery. Most of the procedures that we do will be under local anesthesia with heavy sedation. We have a very good anesthesiologist in the operating room with us who will keep you sedated so you'll be very comfortable. Most patients don't even remember the surgery once it's all over with. The surgery can take anywhere from 30 minutes to an hour and a half. Then you'll be in the recovery room for a few minutes to wake up, and then you can go home the same day. So we always ask that someone come with you to the surgery center and wait with you and then take you home again. You will be sedated for the procedure, so you shouldn't be driving that same day. So you're going to go home with a patch over your eye. We ask you to leave the patch on overnight. We'll take it off the next day. You can take a shower just from the neck down. We might have you positioned face down for a few days. You're going to see some funny things underneath the patch. Sometimes we'll put gas bubbles in your eye. Sometimes the anesthesia will wear off and you might see sparkling lights or other things. Don't worry about the vision that first night. In most cases, the postoperative pain can be controlled with some Tylenol or some Motrins. If the pain is more severe, you can take an ice pack, wrap it in a washcloth. I found that a bag of frozen vegetables makes a great impromptu ice pack. You can wrap that in a washcloth and put it over your eye. If you have pain that's severe enough that you can't sleep or you feel sick to your stomach, there's something wrong. Please call us. A general rule is I ask people to take 2 weeks off from surgery, but everyone is different. Some people that really need to get back to work could be back to work as short as 4 or 5 days. Other patients might need 3 or 4 weeks or longer. There are risks to any surgery. Some of the risks that or the complications that happen are things that are more routine that we can deal with in the clinic. For example, your pressure might be too high or too low after the surgery. I can usually fix that with eye drops. People can bleed after retina surgery. The eye is very unforgiving. Even a small drop of blood that might be insignificant somewhere else in your body, if it gets in your eye, it can make everything foggy. If there is bleeding after the surgery, if you wait a week or two, usually it'll go away on its own, but certainly there have been times when I've had to do a re-op because of bleeding in your eye. More seriously, with retinal surgery, you could get a retinal tear or a retinal detachment after the surgery. I'm very careful, and at the end of every surgery, I go all the way around your eye with a special microscope. If I see anything at all that I don't like, I can laser that, and that usually takes care of it. In rare cases, if the tear is very large, or especially if you already had a retinal attachment to begin with, I'll fill your eye with a special gas bubble. That bubble acts like a brace or a splint to hold your retina in place while you heal. Perhaps the most important thing is to have a good conversation between the surgeon and the patient beforehand so that you know what's going on. I think if you understand what's going on with your eye, then the instructions we give you make a lot more sense. I also think it's important to trust your surgeon. We've assembled a great team. Everyone in the surgery center where we work at, I've known for many years. This is something that you don't go through alone. You have our entire team working for you to give you a good outcome. So we're in this together.